Next, I'm going to talk about Medicare Part D drugs. Before I go there, I forgot to mention a couple points that are in my document, but I didn't mention. And one is, if you go with an Advantage plan, make sure your doctor accepts your Advantage plan. That sounds simple, but and also make sure that the drug plan that's contained within the Advantage plan covers your drugs. Those are two things. And the one way to be sure of that is to use a consultant. I cannot stress enough how important it is to use a consultant. They're free. They understand the ins and outs. And of course, we have the ones we recommend on our website, who Howard will introduce to you later in this presentation. And you can also go to someone of your choice, but it's very, very important. And the write-ups that I did, I just updated them for 2026. They should be on the website in a few days. So with that, I'm going to take you now through Part D drugs. So as I mentioned earlier, not everyone needs a standalone drug plan, because if you got an Advantage plan, it's going to include a drug plan. Medicare plans do not include it. If your Advantage plan includes the drug plan, you still should input your drugs into the MA plan to know your total cost. That's what I just mentioned. The annual election period for drugs is the same as the election period for Advantage plans, October 15th to December 7th. So unless you're turning 65 or first eligible to enroll, that's your enrollment period for change or for newly enrolled, unless you're just turning 65. Veterans also can be an exception because veterans are offered their own drug plan. You should enroll when eligible, or you face a future premium penalty. I discussed that more in the write-up, but essentially, as an example, if you waited 10 years to enroll, you would face about a $46 a month penalty over and above the premium. So the penalties can add up, and some people don't realize they even need to sign up for a drug plan. They think they have a prescription card and they think they're all set. They don't realize, no, you've got to sign up for Medicare Part D, again, unless you have an Advantage plan. You can go to Medicare.gov and input your drugs, or you can provide the list to a consultant or to a Part D insurer to find out the least costs for your drugs. The problem with going to insurer, you'd have to go to multiple ones and try to find the cheapest one. That's not the way to do it. You should either go on the site or use a consultant to find out your drug cost. The difference in cost can be very significant between insurers, and I'll show you some of that. You should price your spouse's plan separately because their list of drugs will generally differ from yours. So they don't even need to be on the same plan. You go what's best for each of you. You may need prior doctor authorization for some drug plans. That's not hard to get, but it could be required sometimes when you're getting a brand drug. They want you to be on a generic. You've tried the generic. You want to stay on the brand drug. You need authorization. It's always less expensive to use the insurer's preferred pharmacy, or maybe the insurer's preferred mail order pharmacy. And that'll actually show up when you price it, because you'll see that a standard pharmacy is going to cost you more for a drug than a preferred pharmacy. Again, the website will do it, or consulting can help you with that. As I mentioned, there's a document, just like I did for the Medigap Advantage plans, Understanding Medicare Part D. It's available on the site under the Health Insurances tab. It includes more detailed instructions for using the Medicare.gov's website. You already have a plan? Then the Medicare.gov website enables you to check out how your existing plan compares in cost to other plans. It'll always list your plan first. You can also do what if. Someone says your doctor's or someone's recommending a drug, you can go in there and plug it in and see what it says about the cost. Keep in mind, when you use this site, for example, if you went in there now, they don't have it loaded for 2026. If you went in there now, it will give you the costs for October, November, December. It'll only give you a 3-month cost. If you go in there when it's loaded for 26, it'll give you a 12-month number. If you go in there in January, it'll give you 11-month number. So keep in mind, depending on when you go in and use it, that dictates the total cost that it's going to show you. You always have the option to use healthcare consultants like we recommend on the site. I've mentioned that. CMS has improved significant price reductions for 10 high-use, high-cost drugs for 2026. There's more to come in 2027. I don't list them here. I do list them for 26 on my document on the site, and I also give you a website to go to find out more about what's coming for 2027. So let's talk about some general rules. Pricing. Drug prices are the result of negotiations between the manufacturer, distributor, and the pharmacy. As a result, there's different prices for the exact same drugs depending upon your insurer and the pharmacy. Formulary is the drug insurers have drug formulas, which is a list of drugs they will cover, in which tier they fall. Very important that your drug is listed in your insurer's formulary. I've had friends that had the same insurer year to year, and all of a sudden one of their drugs is not covered. And they have no choice but to switch drug plans, or they're not going to be covered on that drug. And it could be a lot of money, it could be thousands of dollars, because it doesn't count towards your out of pocket if you're not using a drug that's in the formulary. Tiers. For the purpose of pricing and copays, insurers generally use 5 different tiers: a preferred generic, a non-preferred generic, a brand, and a non-preferred brand or specialty being primarily like a chemo drug. If you're using a preferred generic or a non-preferred generic, that generally does not kick in the deductible. The deductible only kicks in when you're using a brand drug, and that was the $615 for this year, which is pretty high. There's different stages, and they've just simplified this over the years. It may not seem like it, but it's much more simple now. Stage 1, you have a yearly deductible, and the standard amount for that deductible is $615. Some plans are less, some are 0. But keep in mind, though, it may be 0 because you're paying a higher premium. And tiers, and as I mentioned, tiers 1 and 2 do not trigger the deductible. The initial coverage period is stage 2, and you have a copay for your drugs, and that's based on which tier the drug is classified. Tier 1 drugs are generally no charge, and there might be a small charge on tier 2, which is your non-preferred generics. However, it depends on the plan. You are in this stage until your drug cost, including the deductible, but not the premium, reaches $2,100. That number was $2,000 for this year. It's gone to $2,100. But once you get to stage 3, which means you've spent $2,100 for drugs and the deductibles, not the premium, then the balance of the year, your drugs are free. So, but you do have to continue to pay your monthly premium. So when you price them, you've got to look at all 3, because you don't want to be paying a high premium the rest of the year if in fact your drugs are free. Again, by looking at that total, you'll have the answer. Most insurers charge a deductible for 2026, but I'm jumping ahead of myself, I guess. The total cost premium deductibles must be your focus. If you choose a retail pharmacy for your drugs, use your insurer's preferred pharmacy. The site will tell you that, or a consultant can tell you that. Use your insurance preferred pharmacy for the lowest costs. Mail order is not always less than the pharmacy. If you change insurers, you won't need new prescriptions, except for mail order. Then you'll have to send in new prescriptions if you change insurers. If you change pharmacies, ask the new pharmacy to transfer your prescriptions from your prior pharmacy. They can go in and do that. And nowadays, pharmacies automatically receive notice of a new insurer. So I used to tell people to go show them your new card. You don't have to. They go on the system with your information, and they're aware of your new insurer. For 2026, Part D enrollees are eligible for a monthly payment plan for drugs under the new Medicare prescription payment plan. And that was part of the Inflation Reduction Act. What that means is if you have a high, let's say you have a high drug cost every 90 days, you can flatten that out. You've got to go into your insurer and apply for that. But that's a benefit if you want to spread your payments over the year. Again, you can easily enroll online at the website, and I'll show you an example of that. You can confirm the cost with your chosen insurer by contacting them. So if you went on the website and it gave you a price, and now you've chosen Humana, I'll make it up. You can call Humana and say, here's my drugs, and see if that number agrees with what you found out on your own. You can also choose a healthcare consultant, like I've mentioned. They'll help you with selecting an insurer and completing your enrollment. They are not getting very well commission on this anymore. But if they're doing your healthcare, your Advantage or your Medigap plan, then the generally will help you with your enrollment for drugs. But just be aware of that. You have several premium payment options. You can pay with your Social Security deduction, a credit card, bank auto pay, or even by good old US mail. A drug may be cheaper over the counter versus your insurance. And I'm going to show you a great example next. This is an example of using GoodRx, but there are a lot of prescription drug discount drug cards out there, but GoodRx is a popular one. And then on top, you'll see that this drug is called Tamborol. Pardon me, I take a drink of water. Called Tamborol, and it was not in any drug company's formulary. No one covered it. However, you could go get permission to have it covered. However, it triggered a deductible. In this case, was $600, and it was another $280. So it was going to be, if you hadn't met your deductible, it was going to be $800. Well, guess what? By going to GoodRx on this screen, it says you can go to Myers and buy it for $48, which is ridiculous. And it's even more ridiculous when you look at Walgreens charging $369.67 for the exact same drug. And so here's an example where you take your prescription and just go to Meijer and get it filled. You wouldn't use your insurance. And the other thing I want to point out, though, is that's $48 a month. If you're checking it against your plan, make sure you realize this is a 1 month cost. The plan might be quoting you a 12-month cost, but you got apples and oranges there. But my only point is, and sometimes the drugstore will say to you, you know, you can buy this cheaper just buying it without your insurance. They do that more often now. Or you just ask, is this any cheaper using GoodRx? And I go in every year for people and look at their drug list. Generally, your insurance is your best bet, but there are examples where it is cheaper to just use a GoodRx discount. Now I'm going to show you just a couple slides on how the website. This is current picture on this, but I think this picture changes every year but they haven't come out with 2026 yet. But you go in and on the bottom left there, you see you log in and you create an account. And you might say, well, I don't want to create an account. By creating an account, they automatically will show you what drugs you're taking during the year. You may not need them all. They may be one-timers. But you don't have to reload your drugs every time you go in. And then you go in there, and I would tell you to go down and select Find Health and Drug Plans. And it's going to next repeat itself, kind of Find Plans now. You get to choose which kind of plan you're looking for. So actually, you can use this site to go look at Advantage plans, Medigap plans, as well as drug plans. So you can use it. But if I was using this site to investigate some of these others, I would still talk to a consultant. They'll know which insurers are the best in terms of how often they increase rates, things like that. I would still, you might want to use this to understand it better. But again, for this presentation, I'm talking about investigating drug plans. And these are drugs that are already in there. You can remove it. You can add recently filled drugs. Again, it'll list all your drugs that you took during the year. You can add another drug. When you add another drug, you just start typing it. It fills it out. You just follow the prompts. That's what you do. You follow the prompts. You can put up to 5 pharmacies in there. I would tell you to put in 4 and put in the mail order just so you have an idea of what mail order would be. The features of this then, aside from showing you individually each drug plan, each drug insurer, in this case, the WellCare is the current plan for this person. In addition to showing you that, it lists them in descending order. In other words, the next least expensive. And so the system allows you to pick 3. In this case, it's comparing ARP preferred and a prescription blue plan to your existing WellCare plan. You could go back in again and pick another 2, but generally you're going to pick the first 3 because you want to compare the lowest cost of the first 3 or first 2 against the one you have. Once you do all that, you see in the columns, I got 3 different insurers. I got WellCare, Elixir in this example, and ARP. And then down below, using my pharmacies that I'd chosen previously, it tells me my cost. And that's the total cost, including the premium. And so you go through that and you can determine, okay, who's the least cost for me by making this comparison. This is the same thing that a consultant would do for you. And you can see there where on the left-hand side of the bottom where I show Kroger Pharmacy at $1506.96, CVS is only $10 more per year. So if CVS is closer for you, you might just go there. But maybe you wouldn't use Mills because they're $200 more a year. In some cases, you'll see extreme differences. But if you're picking the least cost of the 3, the differences won't be too great. So in conclusion, I've tried to give you a clearer understanding, go look at that document online, Understanding Medicare Part D. I think the site's easy to use, but I've used it a lot, but it is very easy to use, I think. And the more you use it, the more you'll like it. Even if you use a consultant, you can go in there and have an idea of your questions. And keep in mind, like I just said, you can always use a consultant. Last thing I'll mention is Patient Assistance Program. We've published a couple documents on this. It was in our last newsletter. What it is, every manufacturer, not insurer, every manufacturer pretty much has a patient assistance program, which helps people who have high cost specialty drugs, chemo drugs, for example. You can get drugs that are $18,000 a month or more. And with the maximum now at $2,100, it's not as important. But particularly if someone is not 65 and not on Medicare Part D, this program could be very, very important to them. So it's worth investigating. You can Google it, or you can just go to the manufacturing of the drug you're checking and see what they have that's available to you as far as assistance. So that's it. Open for questions. Again, there's a whole lot more detail maybe than you would want to read, but it's worth it. I feel that knowledge is power when it comes to your healthcare.
We have one question, John.
Okay.
You're going to need to change your view, I think.
Okay.
I'll just read it to you. If a retiree is planning to leave the U.S. and move to a foreign country, should they drop D and G and just keep A and B? What would be the cost savings overall, and are there any risks?
Well, in the case of an Advantage plan, you can only get out at certain times. We mentioned those. October, December, and then January through March, you'd get out. A Medigap plan, if you dropped it, you'd be subject to underwriting when you tried to get back in. So that would depend on your health condition. The D plan, the drug plan, I don't think you can drop that. You could go to a zero premium plan. You could switch to a zero premium. Again, you'd have to do that during an open enrollment period. So I would tell you, if you're in good health and a G plan, there's still some risk because your health can change. So I hope I've answered it.
Mr. Kaiser, it also depends on whether they're moving permanently. If they move permanently to a foreign country and they don't maintain a United States residence, Medicare altogether will drop them.
Okay, thanks, Laura.